Good morning. In this video, I am going to make some of the most important questions which are or which can be asked in the paper 2 of pharmacology. See, in pharmacology paper 2, endocrine and antimicrobials, okay, part 1, part 2, along with GIT. These are the three important systems that you have to concentrate. Coming to endocrine, in endocrine, first question, a patient or a female comes with a swelling in the neck, symptoms of Graves' disease, symptoms of hyperthyroidism. What is your diagnosis? What is the classification? What are the antithyroid drugs? What are its side effects? How will you treat hyperthyroidism in pregnancy? In pregnancy, in first trimester, propyl thiouracil is the drug of choice. Whereas in second trimester and third trimester, we will change into methimazole and carbimazole group of drugs. This is the first question, anti-thyroid drugs. Coming to the second question, diabetes. They may give a history of type 1 or type 2 diabetes mellitus. If type 1 diabetes mellitus, they will ask you to explain top to bottom about insulin, its mechanism of action, and ADR. In type 2 diabetes mellitus, they will ask you to explain about what are insulin secretagogues. Not everything they will ask you to explain. They will ask you to explain insulin secretagogues, insulin sensitizers. Okay, what are the weight neutral drugs? What are the DPP4 inhibitors? Okay, weight neutral drugs. Then what are the weight gain anti-diabetic drugs or oral hypoglycemic agents? OHA. OHA means, again, they are meaning anti-diabetic drugs. Don't get confused. So diabetes, make sure you know the classes of drugs, type 1 drugs, type 2 drugs, adverse drug reactions. Third expected question is, they will give a history of a person or a female, post-menopausal female, coming with a history of fracture of neck of the femur. So post-menopausal osteoporosis. What are the drugs you will be using in post-menopausal osteoporosis? Remember, bisphosphonates are the first line drugs. What are the drugs which inhibits bone resorption? What are the drugs which promotes osteoblast proliferation? What is the role of strontium ranulate? It increases osteoblast and it decreases osteoclast. It has a dual action. Then what are the parathyroid hormone analogs like teriparatide group of drugs? So osteoporosis, post-menopausal osteoporosis is a potential question. Then another possible question is steroids. Okay, steroids are a broad, they are a group of drugs which are having a broad spectrum of actions. Okay, broad spectrum of actions in the sense, steroids we use as an immunosuppressant, we use as an anti-inflammatory agents in many conditions, okay. And the second thing, it has a lot of adverse drug reactions. Starting from osteoporosis, it has a lot of adverse drug reactions. So steroids, what is the role of inhalational corticosteroids? Okay, ICS, that is again coming in the respiratory system. Okay, respiratory system, inhalational corticosteroids. Okay, what is the role of inhalational corticosteroids in the treatment of bronchitis? Remember, inhalational corticosteroids, they increases the activity of beta blockers. That is why inhalational corticosteroids we will always combine with what? Beta blockers. Okay, beta blockers like sorry, not beta blockers, beta agonist. Okay, so called as LABA, long acting beta 2 agonist, formoterol, intaketerol. Okay, all these are the salbutamol, all these are the group of drugs. So steroids, make sure you read top to bottom. Okay, they will give or steroid induced Cushing syndrome, because following a high dose of endogenous steroid intake, exogenous steroid intake, the patient will have what symptoms or clinical features of steroid Cushing syndrome. So read about steroids top to bottom. Okay, so these are the potential essay questions. And coming to the short note questions from this chapter, remember, as far as short notes are concerned, again they can ask from anti-thyroid, anti-diabetic group of drugs. They may ask the what specific classes of drugs they can ask. They may also ask about growth hormone deficiency. Okay, octreotide. Okay, somatostatin analogs, octreotide can be asked. Then they can ask about mineralocorticoids, especially fluid, Hydrocortisone, okay, hydrocortisone can be asked. Dexamethasone or beta-methasone steroids, glucocorticoids can be asked. As I have already told you, the role of inhalational corticosteroids in the treatment of bronchial asthma can be asked. Okay, as far as bronchial asthma is concerned, they will give a history of a patient who is coming with a sudden episode of what breathlessness, tachypnea, will be a private what a previous history of asthma. Okay, that is status asthmaticus. The first thing we have to give is nebulizer. Okay, beta 2 agonist nebulizer we have to give. Then oxygen therapy. So what are the drugs we will administer in case of status asthmaticus? That is a very potential question. Status asthmaticus. Okay, then what are the drugs used in the treatment of COPD, like phosphodiesterase 4 inhibitors, roflumilast, okay, long-acting muscarinic antagonist. Okay, so this group of drugs, LAMA. Okay, LAMA is mainly used for COPD, whereas LABA is mainly used for bronchial asthma. So in respiratory system, these are important. Antitussives are important. Okay, what are the centrally as well as peripherally acting antitussives? What are the mucolytics? Okay, what are the mucolytics and centrally and peripherally acting antitussives? So these are the very potential questions in respiratory system. Again, coming back to our endocrine. In endocrine, they can ask about hydrocortisone or fluorocortisone. They may ask about dexamethasone, beta-methasone. They may ask specifically each class of anti-diabetic drug. Then they may ask also ask about the different classes of drugs which promote bond formation and inhibit bond resorption. Okay, I have told you already. So these are the possible set of questions we will get from endocrinology. Once that is done, coming into GIT, they will give a history of peptic ulcer disease. What are the role of proton pump inhibitors? Prokinetics can be asked. What are the drugs used in the treatment of early as well as late onset chemotherapy induced nausea and vomiting? Okay, so these are the very potential questions which can be asked from the chapter of GIT. Prokinetics, okay, prokinetics can be asked. Stool laxatives can be asked. Drugs used for irritable bowel syndrome associated with the diarrhea and irritable bowel syndrome associated with constipation can be asked. Then another set of questions is what this antiemetics. Okay, antiemetics. Especially chemotherapy induced nausea and vomiting, what are the drugs you will be using? And the next question, I have already told you, peptic ulcer disease, which is a classical essay question from the chapter of GIT. Okay, once that is done, let us go for antimicrobials, which is going to give the maximum number of questions in paper 2. First question, typhoid fever history. What are the drugs? Ceftriaxone, fluoroquinolones, they can ask. Syphilis history, they can ask about penicillins. Syphilis history, they can ask about penicillins. Bacterial pneumonia, they can ask about ceftriaxone, cephalosporins. Bacterial pneumonia history, cephalosporin, ceftriaxone group of drugs. Okay, and of course, sure short question, one from malaria, history of fever with chills and rigor. One question, anti-tubercular drugs. Then third question, antiretroviral drugs. Anti-herpes group of drugs. So these which I have mentioned, HIV, herpes, malaria, tuberculosis, make sure you read all the classes of drugs, their important mechanism of action and their important side effects. Don't compromise, because you will get a lot of short note questions along with the essay questions from these chapters. Okay, yeah. Once that is done, remember leprosy. Again, leprosy, what is the current treatment regimen we are following for leprosy treatment? What is the current treatment regimen we are following for tuberculosis treatment? Both are important. Drugs with their side effect. What are the first line drugs? What are the second line drugs? What are the drugs used for the treatment of MDR TB? Second question, what are the drugs used for the treatment of XDR TB? Okay, what are the drugs used in case of rifampicin resistant leprosy? Okay, all these are possible questions. Okay, remember the regimen for, okay, they will give a history of needle stick injury. History of needle stick injury. When we have to give prophylaxis? Yes, immediately we have to start prophylaxis. Maximum within 72 hours we can give post exposure prophylaxis for HIV. Okay, needle stick injury in HIV. Needle stick injury. Okay, in HIV, remember the regimen we are following is tenofovir, lamivudine and dolutegravir. Okay, this is the current regimen. TLD is the current regimen that we are following. Don't write efavirenz, tenofovir, lamivudine and dolutegravir. What are protease inhibitors? What are integrate inhibitors? What are NRTAs and NNRTAs? What are the important side effects? What are the group of drugs? Okay, various drugs which comes. At least in each class, make sure you are reading some 3 to 4 drugs. So these are the must-known questions. So once again, I'm repeating: fluoroquinolones are important. Okay, cephalosporins are important. Penicillins are important. Okay, penicillins are important. What is the mechanism of resistance in fluoroquinolones? What is the mechanism of resistance in penicillin? That is again another question. So we have something called as, in the first chapter of antimicrobials, they will be discussing about what is time-dependent killing, what is concentration-dependent killing, what are the drugs which have these mechanisms. That is also a very potential question. Okay, and okay, once that is done, we will go for malaria, then leprosy, tuberculosis, HIV, and what herpes. Okay, these are the drugs. Then what are the drugs for influenza? What are the drugs for influenza? Anti-influenza drugs are important. Then they may history of what oral candidiasis, what azole group of drugs. They may give a history of mucormycosis. They may ask about liposomal amphotericin B and its uses. Okay, liposomal amphotericin B and its uses. So that are the two potential questions. And another very expected question: what are topical antifungals? What are topical antifungals? What are topical antifungals? Drugs for psoriasis. What are the keratolytic agents? What are the keratolytic agents? In GIT, I forgot to mention one question. What are the drugs used for the treatment of Crohn's disease and ulcerative colitis? Crohn's disease and ulcerative colitis. Okay. Then, what are the drugs in the treatment of surgical prophylaxis? Surgical prophylaxis means before we are doing surgery in a patient, what are the drugs? There is a cephalosporin group of cephalosporins. Okay, these are the main drugs used in the what used for giving prophylactic antibiotics in patients who are going to undergo surgery. So in antibiotics, antimicrobials, these are the things you have to see. Fluoroquinolones are important, cephalosporins are important. Then other drugs, if I ask you, what all you have to focus on, I will tell about linezolid is important. Okay, linezolids are important, carbapenems are important, lincosamide is important. Linezolid, lincosamide, carbapenems. Okay, these drugs you won't read usually. Make sure you are reading about it. Aminoglycosides. Okay, aminoglycosides, adverse drug reactions are important. Adverse drug reactions of aminoglycosides is important. Adverse drug reactions of metronidazole is important. Adverse drug reactions of metronidazole, adverse drug reactions of aminoglycosides are important. Vancomycin is important. Remember, vancomycin is we are using for methicillin resistant staph aureus. Okay, and linezolid is what we are giving for vancomycin resistant enterococcus. Okay, and all we will give actually linezolid only. So remember, vancomycin Redman reaction. Redman reaction is a characteristic adverse drug reaction of vancomycin. So vancomycin, linezolid, lincosamide, carbapenems. So so that covers almost the most of the questions from antimicrobials. Once that is done, we will go for the chemotherapy. In chemotherapy, platinum group of drugs are important. They will give a history of testicular cancer, seminoma. What are the drugs? Again, platinum group of drugs are important. They may ask about anti-mitotic inhibitors. Okay, we have that is vincristine, vinblastine group of drugs are important. Okay, then bleomycin is important, actinomycin D is important, bleomycin, busulfan, actinomycin D, cyclophosphamide and its adverse drug reaction, danorubicin, doxorubicin group of drugs. Okay, platinum group of drugs. Then what mitotic spindle inhibitors, vincristine, vinblastine and taxane group of drugs. Okay, so these are important. Chemotherapy induced nausea and vomiting. How will you treat early as well as late chemotherapy induced nausea and vomiting? Okay, you can see the GIT chapter, it will be there. What are the different antiemetics? Okay, make sure you read all those things. And the next important is tacrolimus cyclosporin is important. Tacrolimus cyclosporin is important. What are the drugs used in the treatment of graft rejection? Of course, when they ask about drugs used in the treatment of graft rejection, you can mention about cyclosporin and the tacrolimus. Then coming into the miscellaneous topics that you have to read. Remember, read about antiseptics. Okay, paracetamol poisoning, aspirin poisoning, lead poisoning, chelators. Okay, what are the chelators? Like we have drugs like valamine, EDTA, okay, DMT, succinylcholine. Then what are the drugs for psoriasis? I have told you. What are the keratolytic agents? Then remember, snake poisoning and its management is again a potential question. Okay, snake poisoning and its management is a potential question. Then they may ask you to write about. They may ask you to write about the management of status epilepticus, status asthmaticus. What are the drugs used in the treatment of alcohol intoxication and opioid intoxication? Actually, that comes in paper 1. And yes, what are the drugs for thyroid storm? Okay, what is the role of insulin in diabetic ketoacidosis? Okay, a patient coming with a chronic diabetes patient comes in with high blood sugar, urine acetone positive. Think about diabetic ketoacidosis. Treatment is regular insulin. Okay, continuous infusion of regular insulin. Okay, that is very important. What are the drugs used in the treatment of hyperkalemia? For the drug system in the treatment of hyperkalemia, we will go for inhaled beta-2 agonist. We will go for regular insulin infusion. What is the first drug you have to use in the treatment of hyperkalemia? It is always IV, 10% of 10 ml calcium gluconate. Okay, calcium gluconate is the first drug used to treat hyperkalemia, followed by insulin, followed by beta-2 agonist. Okay. So these are the what set of questions that you have to remember as far as paper 2 is concerned. Don't miss any questions that I have to. These questions, most of the questions which I have mentioned in the first part of this video, you would have already covered during your routine reading, but towards the mid and towards the end of this video, many questions I have told which very less chance of you to read during your or preparation. So make sure you cover all these things. Okay, all the very best for your exam.